Hi everyone, and welcome to a special Ask the Experts Webcast on mental well-being and good health after prostate cancer. My name is Ricardo Goncalves. I'm a presenter and business journalist on SBS, and on behalf of the Prostate Cancer Foundation of Australia, thank you very much for joining us. If you are joining us live, welcome. We'll wait a few more minutes before we start our conversation with our panel so that more people can join in live. And if you are watching this delayed, remember there are other webcasts on the Prostate Cancer Foundation of Australia website which you can view later in your own time. So over the next half an hour, next hour, what we'll be doing is going through everything you need to know about prostate cancer and more specifically, managing distress after a prostate cancer diagnosis. So things like the common challenges men experience after prostate cancer in maintaining well-being, the factors which can make this more difficult, support for partners, the steps and strategies that can help, and of course, importantly, the resources for further advice. And one of the reasons why we are doing this is because research shows that up to 27% of prostate cancer survivors experience some form of psychological distress and anxiety, and that's 3 times more than the general population. And men with prostate cancer are also twice as likely, compared with the general population, to experience depression. So with that in mind, we have asked you to send through some questions during the registration period, which we will use tonight as a guide for our discussion with the panel. And our panel includes Professor Suzanne Chambers AO. Suzanne is a health psychologist and registered nurse with 30 years experience in psychological support for people with cancer. She is a behavioural science researcher specialising in the fields of psycho-oncology and cancer survivorship. Professor Lisa Horvath. Lisa is the Director of the Department of Medical Oncology and Director of Research at Chris O'Brien Lifehouse. She also leads a research group at the Garvan Institute of Medical Research that studies biomarkers of outcome and chemotherapy resistance in prostate cancer and is an investigator on prostate cancer clinical trials. Judy Jeffery. Judy is a prostate cancer specialist nurse at St George Public Hospital, bringing 30 years of oncology experience across many types of treatment, and her role includes providing care and support to men on all treatment types of prostate cancer, with a main interest in those with advanced prostate cancer. And we're lucky to also have the Hon Jim Lloyd. Jim was diagnosed with prostate cancer in October 2002, having initially seen a GP for travel inoculations. He received surgery in February 2003 and in 2010 underwent successful salvage radiation due to a rising PSA level. And 16 years on, since his initial cancer diagnosis, Jim's regular PSA tests show no PSA levels, and now he uses his experience to educate men about the importance of prostate cancer detection. So thank you very much to the panel for joining us tonight. So the structure over the next hour will be, we'll get a little bit of information from the panellists on their area of specialty. We'll then address some of the questions and themes which you sent through during the registration process. And then at the very end, we'll give you some dot points on what exactly you can do and how you can get help to make anxiety and distress more manageable during prostate cancer. So maybe, Suzanne, we'll start with you, and we'll start with the obvious thing just to set the scene. What exactly is distress?
So distress is different things to different people, but really what we're talking about is uncomfortable emotional feelings that for some people might be feeling anxious or feeling sad or angry, and they're emotional feelings that are uncomfortable and that come in reaction to a stressful event. And so, of course, the diagnosis of prostate cancer or any cancer is a distressing event. We know that the cause of that distress can be about worrying about the cancer and what does this mean about my life moving forward. It can be about how is my life going to change? Am I going to be the same person I was before? And also fears about what might happen to relationships. So there's all those sorts of things that come into it. But really we're talking about emotional discomfort that will be expressed differently by different people.
Judy, what about the different levels of distress? So is distress different, say, in the early diagnosis part of prostate cancer as opposed to the advanced stages?
I think at the beginning the stress is around the diagnosis of the cancer and around the negotiation of the hospital system. And once, you've got into the medical system and you're working through it, recurrence is always a fear. And with advanced cancer, even though you've been in the system for some time, that fear never goes away. And we might look at PSA anxiety, which is all the way through.
I know we'll talk about a lot of this other stuff in more detail very soon. Lisa, what do patients hear from their doctors about distress, and is enough acknowledged about this?
I think it's enormously variable how much patients hear from their doctors about distress. In a consultation, especially the first consultation, doctors are often giving a huge amount of information that technically they are trying to get across, but there's data telling us that people remember about 20% of the first consultation.
Right.
So while most doctors will acknowledge distress, it may take time for them to actually help the patient seek a way around the distress. Their job is to get that huge amount of information across. We'll often engage our nurses very early in that process. But one of the key things that doctors can do to help ameliorate distress, apart from acknowledging that it exists, is giving patients time and having repeated consultations. And I'll often repeat myself several times because people do not remember through the distress from one consultation to the next what was said, because everything's white noise after you're told you've got cancer. And doctors are trying to help with accepting that's that level of distress and working out what are the best communication strategies to help the patient get to their treatment decision, but also to be more comfortable with what's going on.
Are doctors increasingly aware of this?
Absolutely, absolutely. Would I say every doctor will deal with it in the same way? Absolutely not. Some people will deal with it better than others due to circumstance of their practice, when they were trained, what are the level of resources available. But certainly for the majority of cancer doctors these days who work in a comprehensive cancer centre, you would have a psychology service, specialist prostate cancer nurses, which are funded by PCFA and the Commonwealth Government, who would be part of that extended team who would get involved from day one. I would also say that men are often very resistant up front to seek counselling. Even if you walk in and within 10 minutes you know that a man needs counselling, it'll frequently be the third or the fourth consultation before you'll edge them towards seeing the psychologist, because it's just not a part of our culture to do that.
Very true.
We'll delve into that in a few moments. Jim, you were diagnosed in 2002.
Yep.
Given we're talking today about mental health, what was mental health support like back when you were experiencing it? And to what extent do you think attitudes have changed today?
Look, I don't think there was a focus on mental health at that stage. It was very much about the disease and what you do with the treatment and your options. And I think that's the focus at first. It's then an ongoing thing that sort of starts to become an issue, how you deal with the treatment and how it impacts on your family and that. But there really wasn't the support levels that there are now. There certainly was some support, but I'm really pleased to see that there's now a focus on this, because it's really important, because so many men are being diagnosed early with prostate cancer, they're being treated, and they're living a lot longer and living well, and that's what we want, to keep them living well. And to do that, you've got to have a good mental health support as well. So it's really pleasing that the focus is there now.
I'm pleased you're here and very open about talking about your experiences as well, and we'll get into a lot more detail about that in a few moments. What we're going to move on to now is distress and the early stages, and delve into that in a bit more detail. So, Suzanne, how important is psychological care and how integral is it?
Look, it's absolutely important and central because, Lisa was just talking about how difficult it is to understand all the information that your doctor's giving you. And I often say to patients, if you think of your capacity to think, it's like your workbench. When you're distressed, it's like the workbench is cluttered and it's harder to move things around and harder to find what you need. So while you're coping with this experience, which is challenging for anyone, looking after your psychological well-being, your emotional well-being is really very important. It will help you get through that experience, understand what's happening. It'll help in relationships to be able to talk about what's going on, because highly charged emotions make everything more confusing and more difficult. So I think it's very important to be regularly touching base with someone, your doctor or your nurse, about just how you're tracking from a well-being point of view and from the way you're thinking, so that if you're finding that it's getting on top of you and you feel like it's just hard to get out of bed in the morning, it's really crucial to talk to someone about that.
And I would assume that distress would hit all types of men or even family members, but who is at the most risk of distress?
That's an excellent question. So again, stressing that everyone is individual and different. What we do know from the research is that if a man is younger, it's tougher. And that makes sense if you think that through, because if you're younger, you're more likely to have dependent children, your career might still be developing, you've got more financial stresses on you, and also it just doesn't feel natural to get a diagnosis of prostate cancer at a young age. And I've certainly had lots of young men say to me, I just felt like I was too young for this and it was just too weird getting diagnosed with prostate cancer. So being younger, if you're in a situation where you've got other stresses that are impacting on you as well, so that might be financial stress, it might be that you've got other illnesses at the same time, or you've got a lot of stress at home, that makes it tougher. And certainly if a man is diagnosed with a later stage cancer, a more advanced stage cancer, that's tougher too. It's because there's more to think about and I guess more to worry about. But having said that, there are men with all those qualities or characteristics who just find they can breeze through it, and others who don't have those who find it tough. So what I really try to stress to people is don't judge yourself and don't decide how you should be feeling about it or coping with it. It is what it is. And so just recognising, being aware and reaching out if you need to.
We went through some of those statistics about depression and anxiety earlier in the session. So can you tell me a bit more about to what extent mental health is impacted on men with prostate cancer compared to, say, those of their non-cancer peers?
Well, we certainly know that it's higher, as those statistics that you were using earlier. The estimates vary depending upon the research and the way they measure distress, but we've certainly done studies where we've found even 2 years out from prostatectomy, 1 in 5 men have high levels of psychological distress, to the extent of where you would say they had anxiety or they had depression, which means that many men are doing great, and that's terrific. They're back to their usual way of life and way of feeling. But that's a good number that are not doing so well, and we need to find them and we need to help them. We've also done studies where we've tracked large groups of men over a 10-year period and found that about 40% of them might not have anxiety or depression, but they're not operating at the level they would like, and their life satisfaction is feeling impaired and they're feeling like their mental well-being is not what they would prefer. And so I think that's important, because you want to be the best that you can be. You want to be enjoying your life as much as you can. So it's like if you had a wound on your leg, you'd take care of it. So if you're not feeling like you're tracking so well psychologically, it's important to take care of that as well.
And of course, there are resources on the Prostate Cancer Foundation of Australia website, but if you do need to talk to someone right now about any issues that may come about from anything we're talking about mentally right now, there's always resources like Lifeline, and you can call Lifeline on 13 11 14. So that number for Lifeline is 13 11 14. Lisa, maybe we'll move on to you, because we're talking about distress, but how do you know if you are distressed? How do you screen for distress?
So in the clinic, it's about getting to know your patient. You presume that everybody who walks in is distressed. They've just been told they've got cancer. So when they come to see a medical oncologist in particular, they've already got the diagnosis and they're already distressed. Bizarrely enough, the thing that I most often do within the first 10 minutes is tell them they're not dying.
Right.
Because that's the first thing that's on their mind. It's the elephant in the room. Nobody wants to go there. Every other health professional is generally running a country mile from it. And I think it's really important to put that into context.
Why is that, do you think?
Because a number of patients, when I say that, you can see them visibly relax because it's the thing they're scared of, it's the thing they don't talk about with their family, it's the thing they often don't want to bring up in case somebody tells them they are dying. But realistically, prostate cancer has such a long natural history that whether this is a man with localised disease or biochemical relapse or advanced disease, men are going to live for many years with their prostate cancer, and they're going to be managed as prostate cancer is a chronic illness, just like diabetes or heart disease or blood pressure. But we don't refer to diabetes as incurable, but it is. And we don't think of metformin or any of the other diabetic medications as chronic medications for an incurable disease. It's something we manage, it's something we live with. And the first thing I try to do is to refocus the patient along those lines to really equate it, often with the other 2 or 3 other things that are already going on in their lives. But in terms of how do you screen for distress, you have to presume that everybody has a level of distress. But in some men, as you go along, you see that that level of distress in consultations never goes away. And you can see them tense up as they walk down the corridor, as they're getting their results. And I would also say that you also see the level of distress across the family. Distress isn't about a single person, it's about their wife, it's about their children. And frequently you will not only send the patient for counselling, you'll send their wife for counselling or their partner. It's not always a wife, it's often a husband. Or their children, or you're speaking to the school counsellor, because there's a variety of people. It's like that ripple effect on the pond. The diagnosis ripples out amongst the family.
We'll talk about the family in a few more moments in more detail too, but I'm glad you also mentioned the different types of people that are affected, because when we talk about distress, and we spoke about the different stages of distress, right, depending on when you're early or late, but what about the needs of, say, gay and bisexual men? Is that different when we talk about distress?
I don't really think it is, but I work in a practice of the area that I work in, Sydney. Most of the gay men are in very long-term relationships and essentially married to their partner. So really, to me, there's not really a difference. I'm sure there are differences, and I know there are from a study point of view, but the gay men in my practice are just like heterosexual couples. They have very, very similar discussions about the effects on their families and on their relationship. So I don't really see that as much. I would also say that most doctors, we don't do sexual counselling, which falls into that. I would then absolutely at that point hand over to my nurse practitioner to get advice with regards to that, because that's not where most doctors' skill sets are.
Jim, can you tell us about your personal experience? So first of all, how did you find out that you had prostate cancer?
I was very lucky that I was diagnosed through a PSA test. I went to my GP for some general checkups, and he suggested I have some blood tests, cholesterol, that sort of thing, PSA test, and it came back that it was elevated. He said, look, come back another 6 months, and like a lot of blokes, I didn't go back for another 12 months, and he said, you better get another test. It was elevated again, and then I had a biopsy and was diagnosed with prostate cancer. And you were talking about the difficulties for younger men. I was 48 years old. I was in the middle of my career. I can't have prostate cancer. It hits you like a sledgehammer. And, then I had surgery, successful surgery, recovered from that. And about 3 or 4 years later, and this is the anxiety bit about going back and getting your PSA test every few months, and then it suddenly started to rise again. And that, again, is a mental anguish for you. It really is tough. And so then watched that for quite some time, for about 3 or 4 years, until it was at 0.2, and then was salvage radiation was recommended. So I had to go through the 33 days of radiation, which was successful. And at this stage, some 16, 17 years on, I'm probably fitter and healthier than I have been for a long time. Still got a 0 PSA, but the anxiety does not go away. You learn to manage it. But even every 12 months, I still get a PSA test. You're still anxious when you go to the doctor for that PSA test. And so I think with anxiety, it varies through the years. And I think you can't just put it in a box and say, well, you've got anxiety, because I know in the 16, 17 years that I've been through this journey, there are times where the anxiety can be quite high and quite stressful. And that's probably when you really need to talk to someone, get some support. And it can be triggered by other outside influences. And there are other times when you can go for years where really things are back to normal and you're quite happy. So it's an ongoing process.
I think in a few moments later on, I do want to talk about how exactly you're managing your anxiety right now. But just to put it into context as well for anyone that's in the early stages, right? Even though you feel like the way mental health is looked at right now is different to when you went through. What exactly went through your mind back then, and what kind of stage in life were you at? Because you said you were 48.
Yeah. Well, I was a federal member of parliament. I was in the federal parliament, and often there was the fear that it would impact on your career. I had to make a decision, would I go public with this, the diagnosis of prostate cancer? And I chose to. I said, my constituents need to know that. And the message that I say to a lot of younger men in career sense is, I don't believe it should impact on your career, and it didn't on mine. I was made a minister in the Howard government for 4 years after I was diagnosed with prostate cancer. So, it's a positive message that there really is a future out there. Don't think that your career should be impacted or end. And so, there's a lot of good things. And you actually, if you can take some positives out of the diagnosis, it's a journey that you actually learn from. And in some ways, I find that I actually understand myself better by going through that journey than I may have done otherwise. Not that I would wish it on anyone,
right.
But I think there are some positives that you can start to understand yourself. And because there wasn't the support back then, many times you lean on your family for support as well, and your friends network, and also you become a little bit more self-reliant. But now I think it's important. There's so much support there that you need to start identifying when you actually need to talk to someone.
Judy, Jim spoke a lot about PSA, for example. So you run a PSA nurse clinic to review bloods and symptoms. Can you tell us what that involves? And maybe really briefly, just for those people that are relatively new potentially and watching this, just explain what PSA is, but just briefly.
So the PSA is the prostate-specific antigen that the prostate will secrete into the blood system. So, and I'd like to add that a rise in PSA isn't necessarily prostate cancer. So
important.
Men will have a PSA blood test done for diagnosis, but also for monitoring treatment. And the clinic that I've set up looks at men who have advanced cancer who don't necessarily need to come back into the clinic for a blood result. So I am ringing them at home so that they can continue their well-being. They're travelling, they're doing the things that they love doing, they're working, and also I'm doing a distress screening as well. Because not only are we looking at the PSA, but there's financial concerns, there's, as you were saying, Lisa, with people, that ripple effect, children doing HSC. So I'm looking at, I always say to them, I'm not just looking after your prostate, I'm looking after all of you.
When you're doing these tests, obviously they take time for a result to come through. So how long does one have to wait for the results, and how does one manage the anxiety associated with that?
Well, the results actually come through within 2 days now, but depending on the laboratories, it could be 3 days. And I'm very mindful of how important it is. As we were saying, that's the first thing that they want to know. So we're not going to talk about finances. before we've talked about the PSA. So I tend to let them know when to have the blood test done, when I'm going to be ringing them, and so they're all ready to go.
Lisa, given the stress of diagnosis, and we touched on it a little bit earlier, how do clinicians manage this for patients trying to make decisions?
I think it's enormously variable how clinicians manage the distress. And I'm sure that the audience would say that some of them think their clinicians handled it well and some of them think their clinicians didn't handle it very well at all. I personally think the best way is to have repeat consultations to make sure there is somebody with the patient while they're getting the information, because as I said, if your memory is difficult and you're trying to grapple with all the medical terms and all of those sorts of things, having another set of ears, somebody who's writing things down, giving written information, all of those sorts of things, that's about making sure that people don't feel that they have to listen to everything in a consultation and make decisions. Prostate cancer generally does not require anybody to make a decision on the spot. They've got time, they should be able to collect the information and get all of it into perspective. I think there's all sorts of supports around making that decision. There are question prompt lists that patients can use because stethoscopes induce amnesia. I often say to patients, get a piece of paper and a pen, put it by the side of your bed. The most pressing question arrives at 2 o'clock in the morning. You'll walk into my office and you'll forget what it was. But it also means that you expand out from the clinician. I think our prostate cancer nurses are essential because there are questions that my nurse will sit in the consultation with me, but then she will do a separate consultation. There'll be different questions that the patient will bring to the nurse. I do find in the early stages of diagnosis, I struggle to get patients to see a counsellor, even if I think they need one. I think
At what point do you say go see one?
Any point.
All right.
Sometimes I think they should go and see one from the first consultation. But
And how do you say it?
I tend to say, have you thought about a counsellor?
Okay.
I don't think that I'm a bit of a straight shooter.
Right.
But I think a lot of patients want to get the treatment plan in their head before they go see a counsellor. I think a lot of patients think seeing a counsellor is extraneous to making that decision. I don't necessarily think that's correct, but I'm not the patient. And there's only so many places you can push a patient simultaneously. So I like to give people the option, and I always mention counselling in the first consultation and say, if you feel you need it, come back to me. I very frequently, when we were talking about how do you screen for distress, the look in the face of the partner that's sitting behind them often tells you an awful lot. So they're sitting there going, I'm fine, and the partner's going, no. An excellent sign is the facial expressions of the partner behind them. But look, it is very tricky. There is a lot of resistance amongst patients often to seek counselling. They feel they've failed. They say, well, if I can't cope with this, how can I cope with treatment? And it's like, you don't need to be a front row forward and indestructible. You're allowed to be vulnerable. That's what this makes you. And it's not failing to need to see a counsellor. But
that's a really important point. That really is important, because so many men feel that, their family relies on them. They're the centrepiece of it. And yes, if I say I'm vulnerable, then I feel like I'm failing the family, and that's a really important point. So, it's a message that, it's not failing to go and seek help. It's really important that you talk with your family and then, seek some support. And it doesn't, even the word counselling, it's not always going to see a counsellor, but it's talking to other people and getting that support network with you. Sorry, I didn't mean to interrupt there, but I just feel that's a really, really important point to make.
So
Absolutely.
we've spoken a lot about the early stages of distress, right? So if we talk about the ongoing parts, right? So Suzanne, one's got their results, they've got different options. One might have more of the disease, they might have different treatments or side effects to consider. That can all impact mental wellness and make it more difficult, can't it?
Well, it can. I'd like to pick up on something actually that Jim said, and we're dealing with blokes here, right? So they have,
Yes.
and I know you're not supposed to generalise, but I'm going to anyway. And so, and Jim's laughing, so I think he agrees with me. So men do have particular ways of dealing with things often, and often they're very problem focused and they like to do stuff. And so I'll often say to them, you've got things happening all over the place, let's prioritise them. Let's work out what are the decisions you have to make, what are the things that are worrying you, and let's work through that in a pragmatic way about what are the steps that you can take to deal with those things. Sometimes there seems so much, it seems impossible to unpick it and to deal with it, but if you can just take it step by step, pick it off one bit at a time, work out what it is that you're trying to cope with and that you need to prioritise first, and then work out for this problem, who can help me with that? Because it'll be different people. If the thing that's most problematic for you right now is, say, urinary incontinence, see a physiotherapist and get a pelvic floor physiotherapist and get help with that. If the problem is fatigue, an accredited exercise physiologist might be just the right person, and you should be seeing them anyway, to get a tailored exercise program that's going to give you the results that you want and that you need to keep your body strong, get you through this experience.
And who do they speak to know who they need to see?
Well, that's where talking it through with someone, like talking it through with the nurse or the GP or someone from a prostate cancer support group, or working it through with your partner, just to try and make some sense of the thoughts that might be running through your mind.
Jim, I want to take it back to you just for a few moments if we can, because I think a lot of people would love to speak to someone that's gone through it, right? So if you can maybe mention briefly what kind of surgery you had, how you coped emotionally, because from my understanding, the treatment was a long process, wasn't it?
It is. I mean, in those days, the medical advancements has made it a lot easier, I think, over the years now. But I had a radical prostatectomy, so I had my prostate removed. It's major surgery, and you then have the issues of the concerns about incontinence and sexual function, all that sort of thing. And so it's really important to talk to the medical professionals and the support groups. It's very interesting. The support groups are very important, and you can contact them through the PCFA website to find a local support group. But it was almost like a secret men's club. When people found out that you had prostate cancer, and I was in public life at that time, you'd go to an event and someone would come up to you quietly and say, I've had prostate cancer too. And so there's sort of that, camaraderie really, without being an official support network. And often I must say, I think women are better at having support networks and talking about their health more than men are. But, informally, I think if you can find a friend who may have gone through prostate cancer or that you can talk to, it is important. And everyone's different, and the problem is that the treatments are all different as well, and you're worried about the side effects and the ongoing how you're going to go in the future. So the more you can talk to people who have been through that experience, I think the more comforting it is.
You mentioned earlier about your ongoing anxieties, right? Yes. Even right now. So how are you managing that now?
Look, I guess you just stay focused on the positives, and it's not as bad for me as it used to be. Getting the PSA test, but it's still the anxiety the week before. You think, I've got to go and get my test, and then it takes a few days to get the blood test back, and most of the time there's a sigh of relief, and you think, that's great for another year. But it's something that's ongoing. But again, it's again, if I feel that something else has set off stress, talk to my family, and I've got a good family network, and that's important for me.
And speaking of family, so in the initial stages and right now, so throughout the whole process, right, how do they cope? Was there any emotional stress placed upon them as well?
Yes, a lot. I think families really do suffer as much as the husband, the father. I think the hardest thing for me was telling my two boys that I had cancer. because their first reaction, as you say, is Dad's going to die, he's got cancer. So you have to, whilst you're struggling with the diagnosis yourself, you're then having to reassure your family that, look, it's positive, it's been diagnosed early, I think we can have treatment, everything will be good. So you deal with that. My wife is a very strong person and, very supportive, and I've been very fortunate that I've always had her there. She was at the initial consultations. I think that's very important. If you've got a strong partner, your partner in life, if they can be there with you through the diagnosis process, it is really important, because that's a support network that's invaluable.
Lisa or Suzanne, can we delve into that in a bit more detail? So that distress in partners and families, how does that stress manifest?
So I'll start. So first, great point. Partners often experience distress that is equal, if not greater, than the distress that the man, the patient, will have himself. And so often you can get into a pattern where the partner is being protective of the man and putting their needs second. And that's a problem if you're the carer and you're the supporter and you're not being aware that this is stressful for you too, and taking steps to look after your own well-being. So that's my first point, is to say partners need to take care of themselves and their own distress levels also. Often I see with couples a pattern where the two people are trying to protect each other from how they're feeling and not sharing that, and that's can be unhelpful.
Right.
It's not that you've got to share everything all the time, but if you're inadvertently withdrawing from each other because you're trying to protect the other person, that makes it harder for you to support each other. And what we do know is that what's really crucial is that if you're in a relationship, is that you work as a team and you support each other through that. You can still have time out and still do things your own way, but you've got to work as a team. And that can be really hard to do when you're distressed and you're being protective of each other. And so sometimes I'll say to couples, each of you just come up with a practical list of 3 to 5 things that you'd like the other person to do that would help you with this experience, and share those lists and come to an agreement about what you're going to do for each other. And that, I know that sounds a bit artificial, but you can forget to look after each other in the stress of the prostate cancer experience. And it can be as simple as a partner saying, it'd really be important if you could just give me a hug every now and again and tell me that you love me. Or if we could go out for a cup of coffee or go to the movies and remember to do the things we used to do that brought us close and that were enjoyable. So they're not tricky things. Usually they're simple things, but they're things that in the stress of going through a cancer experience you can forget to do.
Judy, I might jump to you if that's all right, because you don't just have experience professionally, but personally as well, because your husband was also diagnosed. Can you tell me about that?
A little bit like Jim, my husband went to the GP for a screening for knee surgery, and a very vigilant GP asked him about his past history, and his father had some prostate concerns. So he had a rising PSA and went on to have a prostatectomy. It's interesting that you're talking about partners. Did I know too much? I found great support in my colleagues, and as time went on, I found that as friends came on board, but also going back to support groups, my husband found it very difficult as a 45-year-old going to a support group with older men.
Oh my goodness, that was me. When I went to a support group as a young person, a lot of the men were older.
So what do they look like, these support groups?
I think everyone is different. They're run by local volunteers and with the support of Prostate Cancer Foundation, and they're really adapted to how it runs. There's some of quite large, 40, 50, 60 men. Others can be quite small, 6 or 8, 10 men, and usually it's often they'll have a morning tea or something like that, cup of tea, and then some of the bigger ones will have a guest speaker on the subject of prostate cancer. So it's a good network, but yeah, I just had to say that was so much for myself as a younger person, so it is tricky.
And having children at primary school was difficult, and explaining to them about the cancer, and like you're saying, you're not going to die, and working through things. And as time went on, I found a month beforehand of the PSA testing, I could see the, not anxiety, but starting to, and as time has gone over the last 16 years, it may be a couple of days beforehand, but initially it was extremely difficult.
Does working in the field make it any easier to cope with emotional distress for you?
I don't know if it's, as I said, it's about having information. I've got the information and we discuss things. It's about communication and looking out for symptoms and looking out for signs that he may be distressed. But also he looks after me. We go out together, we do nice things together. Our children are now grown up, they understand, and no, I think it's really about caring for each other.
I want to take some time now to address some of the questions and the themes that have come through during the registration process. So these are some of the questions sent in by you. We've kind of grouped them together because there were a lot about the same kind of thing, and of course I'll just throw it out to anyone so anyone can answer. So the first one are concerns about uncertainty and consequent anxiety of the effectiveness of treatment, especially when remission period is 10 years. How do you get around that?
Well, I think we'll all have different things to say about that. As a psychologist, what I would say is that it's important to be aware of the role that your thoughts and how you're thinking have on your emotions. And so that sometimes can be one of the hard things, thinking about what if the what ifs. What if the cancer comes back? What if my result is bad? What if this side effect never goes away? And so becoming aware of what you're thinking and the possibility that you're thinking in a way that's unrealistically negative and unhelpful to you, and then getting someone to help you with strategies to challenge that thinking, to say to yourself, once you've figured out what's going on in your head that seems to be driving your anxiety, be thinking about, well, is this really true anyway, or am I catastrophizing or doing black and white thinking? And then replacing that thought with something that's more helpful to you. So not beating yourself up about it, but just recognising that there are different ways you can think about it that will be more helpful to you than the worrying ways. Because whatever you're thinking, the same thing's going to happen. You know, you're the same person when you wake up the next morning than you were the day before, but you'll be more distressed if you're thinking about things in an overly sort of mean way to yourself. One thing I've often said to people is be your own best friend. So if your own best friend was feeling this way and thinking this way, what advice would you give them? And then give that advice to yourself and follow it.
Issues around quality of life after radical surgery, namely around sex life. How do you deal with that?
Well, I think it's about getting help, you know, asking the consultant for a referral and going back to the urologist as well. I think this multidisciplinary team that we work with, we need to use.
We spoke about families and partners, and one of the most common questions we got through the registration process was what exactly is there in terms of support for partners. A lot of questions specifically about, you know, one's sexual desires have been diminished following surgery or diagnosis. They've got a lot of guilt that their partners are missing out, especially when it comes to sex. So how does one deal with that?
Well, I can jump in again, just because I have a lot of couples who talk to me about these issues, and it comes back to, you know, I was saying earlier, sharing information, because I'll often have a fellow who's saying, I feel guilty, I feel bad, we don't have sex the same way we used to, I feel like I'm letting my partner down, and then the partner will be sometimes thinking, he's not coming near me because he doesn't find me attractive anymore. Now, you can see that's not, that fear that I'm not attractive anymore as a partner because my bloke's not approaching me is not true, because the reason why he's perhaps withdrawing is because he's protecting himself and he's worried about disappointing the partner. So they've got all this stuff going on in their head that's not true and not helpful. So if they can just talk to each other and share what's most important. I'll often say to couples, how long have you been together? And often it's a long time. Think of all the things that you've done together and you've established and you've achieved, and that's like your big platform that you've built your house on.
Right.
So the platform's solid, maybe the top of that's feeling a bit shaky right now because of everything that you're going through, but don't forget the platform and then work together as a team to rebuild that closeness.
Another question in terms of sex, and maybe one for you, Lisa. Can sex make the cancer worse?
No, absolutely not. The sex didn't cause the cancer. Sex won't make the cancer worse. Sex is fine. But I think the other thing that I'm hearing from all of these answers is, for men and partners out there, is ask. If you need something, ask. Ask your doctor. They may not always be able to do the counselling themselves, but at least they'll know who to send you to. And it's not a bad thing to say, I'm struggling with this. I don't know. I'm struggling with intimacy. My marriage is falling apart. What am I going to do next? Doctors aren't just there to give you your PSA reading and say, see you later. You've got that consultation because they're there to work out the problems. And if your doctor hasn't sent you to your nurse practitioner or hasn't sent you to a psychologist, ask them about it. They're not going to get upset with you for asking the question. They'll probably be incredibly impressed that you asked it, because most people won't.
A few of the questions that came through as well was about concerns with side effects, I guess, essentially with hormone treatment, right? So some specific ones were things like, does hormone treatment lead to dementia? Does hormone treatment lead to depression? Is it really worth going through it?
Well, I don't think it leads to, but we do know that if people have depression, then it can make the side effects worse. But also we need to look at exercise, get men back out, losing some weight and getting their vigour back.
Again, with the exercise, there was a couple specific on foods and exercise. So which types are best to assist with dealing with prostate cancer and distress?
In exercise, or we do know that there are programs, aerobic, and also for bone health is really important.
And when we talk about aerobic, we mean?
With an exercise physiologist. I think an exercise physiologist will put a program together which looks at other comorbidities that the patient is experiencing, and I think they find that a lot of men I ring when I'm doing my calls, their wives will say, oh, sorry, Bob's not home today, they're at the gym. And they've got, support as well there.
Can I jump in and say the patient that says to me, I walk around the block once a day is not sufficient?
Well, that's what I was trying to get at when I said what kind of exercise is it exactly?
It needs to be mixed. So patients often say to me, well, I've always been fit, I've always walked the dog, I've always done this. No, it's about more than that. It needs resistance training. Your body is undergoing some changes. What you've been doing for the last 30 years or 40 years, you need to do other things. You need a professional. And I must say that's not only for the men with prostate cancer. I frequently find their wives go with them to the gym, because some of our patients actually bond around the fact that the hormone therapy starts around the time that their wives have just gone through the menopause, and they're sitting there, and I'm talking about hot flushes, and their wife's jigging them in the ribs, and oops, there goes my microphone. And very frequently I see couples who say, let's address this together, and that in itself can be healthy for both of them from a physical point of view, but I think very healthy from a relationship point of view, when they're both heading into this together.
I guess exercise is one of those things that anyone can do, or it's an easy thing to do to help. Jim, did that have to change for you?
It did a little bit, but I've got to say it's been in the later years where exercise has actually been really important to me. I've lost a lot of weight, and I do go to the gym 2 or 3 times a week, and I really encourage people to do that, because it's not just your body, it actually helps your mind. And it's only been really the last few years that I've done that, and it's something I wish I'd done earlier. But what you're saying, It's not just passive exercise, but it's not something you don't join the gym today and then suddenly want to do 30 minutes on the treadmill. You need to work up to it and get some professional advice as well, but it's really important.
And what about foods? Does that make a difference?
I think
No.
What I
There's
will
101 diets.
What I will say about food is that what's really important is to, particularly if you're on androgen deprivation therapy, is to maintain your muscle mass.
Yeah.
And so what you eat is really important. And I think some professional advice about that, say from a dietitian and your exercise physiologist, is a good idea. Because if you're wanting, and of course being a healthy weight is a good thing, but if you go on a diet where you calorie reduce and you're not doing anything to build your muscles, you can lose more muscle, and that's not a good thing for your body as a whole and for feeling strong. So I think getting advice about that so that these things are all working together for good health.
I think as... oh, go on.
I was also going to say there are lots of extreme diets on the internet.
Right.
And I would steer away from all of them. I would absolutely concur with what Suzanne's just said. If you want to do something about your diet, go see a dietitian. But some of the stuff you see on the internet it's unsustainable and it's not good for you.
I think one thing also maybe to address when we talk about stresses, right, and distress, and as a finance journalist, one of the things we say is if you're unsure, go get some financial advice. But one of the big barriers to getting that is the cost to getting it, right? So when we talk about go see, get some advice about your food, get some advice about your, what medications you need, how do you deal with the financial stress is what I'm trying to get at.
Well, one thing you can do is if you go to your GP, there's Medicare support for allied health when you've got a chronic disease, which prostate cancer is. So, and you get a certain number of sessions supported by Medicare each year. So that's where I think the GP is really important, is to go to the GP, lay out your concerns and get the GP to do the proper assessment and the referral so that you get the support that you need.
So before we wrap up, we've got about 10 minutes. I think one of the key messages in this broadcast is that while distress is a real thing, one doesn't have to experience it alone, and that there is help out there. So I think what we might do is go through some dot points one by one just to hit home what can be done. So the first one maybe, Lisa, is getting some decision support.
So I think decision support is really important. That decision support can be question prompt lists, going on to things like the PCFA website or the Cancer Council websites where there's information so you can go in there feeling a bit empowered around these things. Talk to lots of people. Make sure you've got somebody with you in the consultation who can go home and talk to you and say, well, I heard this and I heard this and let's have a conversation about it. And also feel free to speak to your GP about it, to speak to your prostate cancer nurse, and to get a second opinion if you're not comfortable. I always say you get a second opinion on your car. If you're not comfortable with what your healthcare is, get a second opinion on that. You may still go back to the original doctor, but at least you're comfortable with the decisions you're making.
And also understanding the role of the GP and the specialist psychology or nurse counselling support.
Yep, absolutely. All of those things are available. They can be available through the practice that you're seeing, the cancer centre you're seeing, or through your GP. There are multiple places where you can access specialist nurses, counselling, and a variety of people who will help you through that process.
Jim, how important would you say good communication is and letting people know just when you need help?
Oh, it's critical. And it's good communication with yourself as well. By that I mean you need to actually talk to yourself and say, there are times when I need help. Because it's an interesting process and blokes really keep a lot to themselves. And so recognising when you need help. I'll go back to the diet thing. As a bloke, I don't need help with a dietitian. Losing weight, it's easy. You stop eating and you do a bit of exercise. And I tried for years because I was so stubborn until I worked out that I actually needed help. And so when I asked for help, I lost 17 kilos over 12 months with a dietitian, because I asked for help and I got the result. Well, it's the same with the mental side of things. When you actually come to the terms that you do need to ask someone for help.
I think people will listen to that and say, what exactly did you do? What did you do that was different in that 12 months when you lost the weight?
I got knowledge. I got an understanding of what I could eat, and it wasn't a sacrifice. I was taught to find foods that were non-fattening that I enjoyed. So I was in touch with my body and understanding what was going on there in a process that I just couldn't do on my own. And I think in an anxiety sense, that's if you can get the right sort of counsellor that you can relate to, they can help you understand your body and your mind and your stress levels and how you can manage those. I think that's really important.
Suzanne, for getting some help and dealing with stress, couples working as a team, how essential is that?
It's absolutely essential to work as a team, and so be kind to each other and give each other a break. Be compassionate with each other. Share information about what you need in a non-judgmental way. It's difficult for everyone that's involved in this, so you've really got to give each other some leeway.
I guess, though, if you're single, though, how do you deal with that?
Yeah, and I'm really pleased that you brought this up, because we're talking about lots of things that might not be available, and it's hard when you're single because you don't have that person there, and that's where I think finding good friends who can act as your buddy, you'll have a social network. Look for who are the people that you can trust in your social network, who can be close to you and be a sounding board. Reach out to prostate cancer support groups who often will be able to just talk to you on the phone and get that support. Talk to your GP. See what's available for you. Because the other thing I just want to mention quickly is to acknowledge that it's easier in the city sometimes because there's more resources available, and so it can be hard for people in rural and regional areas to reach out and find help. So that's where telephone helplines can be important. And there are support groups all over the country.
And how do you find them?
Well, you can contact the Prostate Cancer Foundation of Australia, and they will have a list of resources and they'll be able to connect you up.
Okay. Jim and Lisa, we were mentioning as well, when you see a doctor or a clinician or someone, to write things down. How important is that?
Incredibly important, because you need to be able to go back and review what you're doing. You can sometimes ask your clinician if you can tape the interview. You can't do it without their consent. But I certainly, as a clinician, have no problems being taped, because it often does help people to play it back and think about what was said and hear it again. Never underestimate the power of repetition and thinking it through and allowing yourself time to get that understanding.
And I will say that in my practice. Can you tell me what the doctor has told you today? And sometimes it's that feeling as though they haven't heard anything. And so if I've been part of the consultation, I can go back through with them, and I actually have a tick list, and we sit down and we work through it together. So they've actually got a piece of paper to take home with them.
Maybe, Jim, I'll let you have the final word, because I think a lot of what we've spoken about today about distress can be quite mentally challenging and put people in a dark space, right? But what would you say about someone that's going through that right now, in terms of, is there light at the end of the tunnel? Does things get easier? And your experience?
There is light at the end of the tunnel, but it's important to understand that what you're going through is not unique. I know I've felt it myself, and I think a lot of men feel that no one actually understands what you're going through because you're going through it and you're the only one that's going through it. You're not unique. I think every man who has prostate cancer goes through some level of stress, and it varies. But at the end of the day, there should be room for a lot of optimism, and, just get the support, talk to your friends, talk to your network groups, talk to your partners, and be very positive that, with good diagnosis, good treatment, and the treatments are getting so much better every week, every month. There's a lot of optimism and a lot of reason to be very hopeful.
That's wonderful. I'd like to thank our panel today, the Honourable Jim Lloyd, Judy Jeffery, Professor Lisa Horvath and Professor Suzanne Chambers. Thank you very much for your time.
Pleasure.
And thank you for joining this webcast, which was proudly sponsored by Astellas. If you joined the webcast late, it will be uploaded on the communities section on the Prostate Cancer Foundation of Australia website at a later date. But remember, the website has got plenty of information and resources to help you gain even more knowledge about prostate cancer, and all the other effects that goes along with it. And remember, if this webcast did raise some mental health concerns right now, you can call Lifeline on 13 11 14. So that's Lifeline on 13 11 14. Well, I hope you can join us for our next webcast. It'll focus on prostate cancer and lifestyle, exercise and nutrition. So it'll go further and extend on some of the things we spoke about today. That'll happen sometime in November. So just check your emails or the Prostate Cancer Foundation of Australia website or social media, Facebook or Twitter, for example. I'm Ricardo Goncalves. I'll see you next time.